Hi, folks. This is Harold Ree with the Paw Print Animal Rescue Podcast. Before we get to the amazing Dr. Kathy Cooney, just wanted to make one observation. This is the 1-week anniversary of the church shooting in Sutherland Springs, Texas. 26 people were killed, 20 people were injured. The reason why I bring this up is the 26-year-old male shooter had a history not only of domestic violence, but of animal cruelty. There was a time when he lived in Colorado, and he was brought up on charges of animal cruelty. He had a companion Siberian husky, and neighbors found him aggressively punching and harming the Siberian husky. The neighbors called police. He was brought up on charges. Ultimately, he was basically fined. There is a link between animal cruelty and violence towards humans. Whenever you see or witness animal cruelty, be aware that the people around them could be boyfriends, girlfriends, husbands, wives, partners, children, stepchildren, could all potentially be in harm's way. As the Animal Legal Defense Fund notes, make sure to help those people develop a plan, to seek shelter, seek legal advice, and find a way to support the victims, both animals and humans. We'll have a link to the Animal Legal Defense Fund on our show notes. Thanks for listening, and on to the show.
This is Paw Print, an animal rescue community, episode 149. I'm Nancy Ree.
And I'm Harold Ree.
Today's guest is Dr. Kathleen Cooney.
Every gray hair tells a story. I love to be able to connect with my families, to just support them in what is going to be a very difficult time, can be a very sad time. And if I do my work well, they get to cry in safe space. They get to share those stories in safe space. We really build a relationship.
We're super excited to have Dr. Kathleen Cooney on the show today. She's one of the foremost experts on hospice care as well as palliative care for our companion animals. We want to say thanks to Lorrie Shaw for connecting us with Dr. Cooney as she shares her journey with some of her favorite animals. If you want to learn more about Dr. Cooney, go to our show notes at thisispawprint.com/149.
I'm very blessed to do the work that I do. I actually started in veterinary medicine about 13 years ago now and did private practice right when I got out. And I knew that something was missing. I just wasn't making as close of a connection with my clients as I really wanted to. And after having started in end-of-life service, where now I get to focus with families during the dying process of their pets, talking about hospice support, palliative care, everything we can do to provide comfort, and getting to help families, through the difficult time of euthanasia and even with the body care of their pet afterwards. I am so blessed to be able to do this work. And it's just incredibly enriching. I start my day with looking to see how many families I get to help, kind of who my staff is scheduled up for me to see throughout the day. But I often help anywhere from 2 to 5 families a day, very common. And my new work, I should say, is in the last couple of years. I have switched to only providing services for families for hospice and end of life here at what we call my Comfort Center in Loveland, Colorado. And it's here on my beautiful 35-acre farm, where people come to see me and get kind of a break from the busy vet's office, which can be a little bit stressing during end of life, that they get to come here. So I used to, for years, go to everyone's home, and I certainly believe that home care is very, very important for hospice and the end of life experience. But I have another team that does that work in the home, and so I get to stay here at my Comfort Center and on my farm and just welcome families in, and we sit and we talk anywhere from a half an hour to an hour and a half, just depending on their needs, and formulating care plans. And when it comes to helping with euthanasia, I often sit and work with families for up to an hour's time, and it's just absolutely wonderful. And I really enjoy regular veterinary medicine, but now that I get to focus with families at end of life, I can't imagine doing anything else.
Sounds like a beautiful setting.
We call it a bit of a pet paradise out here. It's beautiful rolling grass and beautiful skyline. I don't know if you've been to Colorado before, but it's really quite magnificent, and we got a view of the mountains in the background. So what's interesting when people come here is that, they don't necessarily know what to expect. In fact, we have a lot of families that come here to me for the very first time. They go to their regular veterinarian for routine care, vaccinations, physical exams, everything that the pet may need for its care during life. But then they come to me for death. They come here for the end of life, and so they've never been here before, many of them, and they're quite surprised just how inviting it is. And it's a bit like a little cottage house, if you will. And so they walk into my comfort room, which a lot of veterinary clinics now have comfort rooms for such times, but my comfort room has carpets and couches and French doors and a memorial garden, and it's really just quite a sanctuary in a very difficult time.
You have a couple of different entities that you work on. One is Home to Heaven. The other one is Cooney Animal Hospice Consulting. Would you care to differentiate the two services?
When I graduated veterinary school in 2004, I did do 2 years of private practice and found it very rewarding. But like I mentioned, something was missing. So in 2006, I formed Home to Heaven here in Colorado, and Home to Heaven is a mobile pet hospice and euthanasia service. And that initially, actually, I should say, was just exclusively euthanasia. That's all I did in the home environment, helping families with that. And after a couple of years, something was missing. And I realized that there was a lot of struggle that my families were going through, trying to make a decision either for euthanasia or against euthanasia, and looking for extra options. Were there other care options and support that they could provide to their pet versus needing to choose euthanasia? So Home to Heaven morphed from mobile euthanasia service into pet hospice and euthanasia. And so then Home to Heaven grew from just me into now 13 staff. We have about 7 doctors on staff, and the rest are support staff. So I've been blessed to be a part of Home to Heaven since 2006. I did, though, sell that company in the beginning of 2016 to one of my doctors to provide me time to do what I also love, which is teaching and writing and those things. So I've taken everything that I've learned through my work with Home to Heaven and also work that I've been doing with a national organization called the International Association for Animal Hospice and Palliative Care, taken everything I've learned from both of those groups, and then formed Cooney Animal Hospice Consulting in the beginning of 2016. So the consulting company now, we do that here so that we can do some business training for other veterinarians and service providers like myself that are looking to do better medicine, do better, just business in general, understand the broader scope of animal hospice and palliative care. And so that consulting company has been something that's been just kind of blossoming and growing now for about 1.5 years. And then actually another entity that I have that you may find beneficial to your audience is that in 2016, I also formed the Companion Animal Euthanasia Training Academy. The Euthanasia Training Academy is meant for veterinarians, for technicians, and really anyone who wants to learn best practices, as we say, within the world of companion animal euthanasia. So in shelter settings, for example, the shelter technicians, they do have to go through a training program, but that's usually shelter supported and funded. And then this program that I've developed is a 10-hour certificate program that is meant to take kind of usually where there's a lack of education in veterinary schools and technician schools and take it to the next level for euthanasia. Because believe it or not, many veterinary schools have little to no education around euthanasia at all. And so the Companion Animal Euthanasia Training Academy is just help fill in those gaps and teach those that don't know a lot about it. So I'm just, like I said, very blessed to be able to help in many different arenas within end of life. But I do still get to help families through Home to Heaven and doing that hospice and palliative care work, and then also do the training that I get to do.
Defining language. What would be an example of hospice, and what would be an example of palliative care? I mean, maybe they're the same things in your mind, or maybe they're two separate things.
So hospice, animal hospice, we would say, begins for a patient when a life-limiting illness has been diagnosed, or where we recognize that age-related changes are advanced enough that death is coming. Okay, so there's no set time frame necessarily, wherein with human hospice we might say, well, I know we say, that a patient can enter into hospice when death is expected to come within about 6 months. So we can say the same for animal hospice, but it's not very rigid necessarily, as we don't have insurance and Medicare kind of guidelines in animal medicine or veterinary medicine that we have to do for humans. But coming back around, that hospice is going to provide comfort care from that diagnosis all the way to death, and then beyond with emotional support for the caregiver, because we know that in hospice, our patient is actually not just our pet patient, but the caregiver as well. They're a caregiving unit. And so we are going to provide medical support and emotional support for the pet as it's dying, and then emotional support for the caregiver after. And in human hospice, emotional support for caregivers, for human caregivers, actually carries on 13 months past the death of the human loved one. So in animal hospice, we tend to try to do the same through phone calls, emails, sympathy cards, and just following up with our families. So hospice is, again, very integrative with physical and emotional support. And with that medical or physical support, that basically means palliative care. So palliative care is non-curative medical support aimed to minimize the effects of the illness, but not necessarily make them go away. Does that make sense so far?
Thank you.
Yeah, so to palliate actually means to cloak or to hide. So the disease is still present, but it's just not as obvious. Okay, let's just take osteoarthritis pain. So many of our animals experience that as they're getting older, where the joints just are becoming painful. They don't work as well as they used to. So we provide a lot of pain medication to help to minimize what the pet is experiencing and help them to achieve a good quality of life for as long as possible. And so in hospice, you must have palliative care. But you can have palliative care during the course of a pet's life without requiring hospice. So what I mean by that, let's just take diabetes, for example. Diabetes is a condition that many of our animals struggle with throughout the course of their life. There's many different reasons for it. But if we're giving things like insulin or changing the diet, what we're doing is trying to make diabetes less noticeable and maybe slow the progression of the disease, but we don't necessarily cure it unless we're lucky. And so we're palliating that condition without curing it, but maybe the pet is nowhere near the end of life. So you can have palliative care by itself, but you cannot have hospice without palliative care. And so again, palliative care is any sort of medical management that we do to minimize those symptoms. And it can be through traditional medicine, such as, pharmaceuticals that we think of like pain medication, antibiotics, but it can also be through alternative therapies like acupuncture, chiropractic, herbs, and homeopathy. All of that we can incorporate in to benefit the pet. That's really the name of the game of the work that I do, is what can I put forth to my patient that's going to make them comfortable, but not, make their quality of life difficult, especially as they're nearing their final days. I don't want them struggling with a lot of medications and having caregivers, where it can be challenging to give 10 different pills a day. We want to find just that right mix of everything to help keep a good balance of quality of life for everybody involved.
Thank you for the education. Appreciate that. From the time that you really started specializing in this to now, there's probably been maybe some attitudinal changes. I mean, what have you seen when it comes to either your patients or doctors, or even, because we're an animal rescue podcast, maybe from the animal rescue folks you may interact with?
Sure. Another good question. So the movement, I'm going to say, really started to gain hold about 7-8 years ago. There have been lectures and talks and articles written, even some guidelines from the American Veterinary Medical Association back in 2001. So there's been some movement happening, but really in the last 7-8 years is when things started to gain momentum. And it's because of a lot of veterinarians out there in particular and technicians that were wanting a more enriching experience, first of all, for their clients. And we know, certainly within the rescue world, the beauty of the human-animal bond. So as that bond has been deepening in our society, there's been a lot of people recognizing that, hey, we can do more at the end of life, and we should. What we're witnessing and experiencing is what we call a paradigm shift, right? Where maybe back, even 30 years ago, the old adage of take these pills and call me when you're ready for something like euthanasia was mainstream, commonplace. We didn't know much else. But now with the advancement of palliative care and all of the different modalities, medications and therapies that are available, now we can do more. So the paradigm shift is taking place to say, well, let's try some things. Let's maybe not reach for euthanasia quite so early, and let's provide better support. Within the animal rescue world, what we've seen is that the terms geriatric and senior, and in particular, of course, hospice, are becoming more readily used. People are talking about it more and saying, well, now that palliative care is out there and we've got these options, hopefully we can adapt out the seniors and the geriatrics more readily because we've got treatments, we've got some more comfort care. In fact, myself, it was in 2014, I believe it was. No, it was January of 2014. I adopted a 14-year-old chocolate lab from a rescue here in Colorado. And the foster family and the rescue had pretty much given up hope, who was going to adopt a 14-year-old chocolate lab. But someone like myself, who's got a lot of experience and comfort with caring for older dogs, was willing to adopt her. And, was able to give her a beautiful life for another 1.5 years. So I love to hear and do hear commonly about rescues that are having more success with adopting out the senior pets because more families are embracing hospice. They're not as afraid of death. And I guess we kind of have to face it. When we adopt an older dog or pet in general, we know that time's limited. And if we can and provide, even a few more months and, who knows, sometimes more years through good palliative care, then people are more willing to bring these sweethearts into their home and care for them. So definitely been seeing that trend. In particular, I would say over the last 5 years myself, but there's a lot of rescues now that are focused strictly on the seniors, and I love that.
Yeah, absolutely. Senior dog, senior cat rescue has definitely made it more, even in the newspapers, right? More newspaper stories are oriented around that.
A lot of good success stories out there for people that are willing to bring those pets into their home. And what starts to make that happen, in fact, I was very honored to have a conversation with those high up in the Humane Society of the United States within their leadership program, if you will, is that, or their leadership team, was to talk about that if we veterinarians and veterinary teams in general give our families better end-of-life experiences for their pets, they are much more willing to go out and adopt the seniors because it wasn't as frightening as they thought it was going to be, or they just had a much more balanced and enriching experience, and they feel like they can do that again sooner. Because, so many people in my world that I've heard over the years that didn't have a lot of hospice and palliative care support at the end say, I never want to go through that again. That was just too difficult. And my clients that I've worked with find that they very commonly go back out and adopt pets sooner than they may otherwise have. And like I said, are more willing to adopt the seniors and give them a loving home.
Any success stories that really come to mind?
Got lots of them. Trying to think of one that would be a good example right off. But yeah, I worked with a family recently with a cat They actually had this sweet girl for a long time. She's about 17 years of age. And she had the type of condition, she had cancer. I won't go into too much detail, but she had cancer. And her regular veterinarian wasn't sure how much time she would have and wasn't sure how much more palliative care that they could provide. And so this family was referred to me. And when we sat down and did our initial hospice and palliative care conversation, I always like to ask families what it is that they want for the death of their pet. And again, that's not a conversation we often have with our clients is, well, how do you want your pet to die? It's usually we get lucky and they just pass in their sleep, or we choose euthanasia, right? So this particular family, with our conversation, we spoke for about an hour and a half, and I said, what do you want for her death? What is important to you? And they said, well, we really don't want to euthanize if we don't have to. We would love for her to be able to take time and have her exit her body when she was ready. And so the conversation, of course, shifts at that point, and we really have to talk about that more involved care, as I mentioned before. We have to make sure that her pain is being managed, that she's breathing comfortably, that she's able to sleep good, deep, comfortable, long hours, which tells me that she's, pain-free and very relaxed. And so we actually had a 3 or 4 day, kind of death journey with her. She actually turned out to be closer to death than we realized initially. And it was very peaceful and beautiful all the way through. In fact, I was there about an hour before she died naturally, and we provided even more palliative care for her. And the family after was so grateful. They weren't pressured into anything, that they had options, and that they could be with her in their home in a very serene and peaceful setting. And they got to say goodbye in the way that they wanted to. So that is one story that comes to mind that was very special. But yeah, I'm blessed that I have hundreds of them, of all these wonderful families I've got to work with over the years.
Okay. Wow. Amazing story.
Yeah.
We're talking to Dr. Kathy Cooney, one of our leading experts when it comes to hospice and palliative care. Nowadays, as you're training more and more folks, what backgrounds are you seeing?
When I first started into this, like I said, about 2006, there really wasn't anything out there for regular, consistent training. There had been a couple conferences, a couple lectures here and there, and the AVMA had published their veterinary hospice guidelines in 2001, but very, very short, just a few pages. So with the development of the International Association for Animal Hospice and Palliative Care in 2009, that organization, more than any other, has put forth educational platforms. So in 2013, they wrote 50-page guidelines. I was one of the authors on that. And that's free. That's accessible to anybody who wants to go to the IAAHPC.org website and download the 50 pages practice guidelines for hospice and palliative care. It's wonderful. And then the IHPC has annual conferences. We happen to have one coming up in Seattle in October of 2017. And then the IHPC also has monthly webinars for members. And what I love is that in 2016, the IHPC launched the very first ever in the world certification program for veterinarians and technicians to become certified in hospice and palliative care. And it's a 16-month course. It's mostly online. And right now it is for veterinarians and technicians, but very soon it's going to expand for social workers, possibly chaplains, and others that want to provide or be a part of the animal hospice team. Because one thing I haven't really talked about is the fact that it really requires a team approach to provide hospice well. A lot of mobile services out there may be just, one doctor that's providing the majority of the care, but most of those practitioners or providers have a whole host of people that they can call upon for offering ancillary services. But anyway, it's a team approach. And so as many of those team providers as we can start to get certified, or at least providing more certificate courses and additional training, that's kind of the goal of the IHPC. And then in conferences around in general, There are more and more lectures that are happening, so that can provide either continuing education credits for those who need it, or just good basic knowledge. And also something that anybody can pick up at any time. There's now 2 books on hospice and palliative care that have been written. And sure, they're kind of geared more for veterinarians, but anybody can benefit. Yeah. One of them is called, let me see if I get this right. I believe it is Palliative Medicine and Hospice Care, from a publisher called Veterinary Clinics of North America. And that came out quite a few years ago. But just this year, there was a new book called Hospice, and I know I was going to forget this title, and I was going to want to read it to you. It's Hospice and Palliative Care for Companion Animals, and that's through a major publisher, Wiley Blackwell. So that is a game changer, just an absolute game changer, to have books like that could eventually be even textbooks within veterinary schools. And so yeah, a lot of new resources that have come forth, really probably mostly since 2013, but boy, the sky's the limit now. It's really, really taking off. One of the driving forces within hospice in the human side is to try to get patients into hospice sooner so that they can get that really good palliative care to make a difference. It's just night and day difference for those that are experiencing their last days, last months even. So when it comes to our senior pets, what I love to see is pets to go in for what we call just geriatric wellness visits or senior dog wellness visits, and really look over those beautiful bodies with a fine-tooth comb to try to identify any things that are going to become troublesome, such as early arthritis, lumps and bumps, hearing loss, those types of things, to say, what can we do now to try to stave off a more rapid decline towards end of life? So what kind of palliative care can we implement now? Comfort care, maybe sometimes curative, just depends, but otherwise just palliative care to keep that pet more comfortable and prevent that faster decline without it, right? So if they don't have anything, such as joint supplements, pain management, great diet, probiotics, you name it, a lot of different things that we can give to our senior pets to help them age more gracefully. But that's what I'd love to see everybody start to do sooner. And then eventually, we know all of our pets are going to reach the end, and that's where hospice becomes more important. But we can start much, much sooner with good comfort care to help them age more gracefully. I just got done giving a webinar for the Humane Society's Veterinary Medical Association, and it was called Household Modifications for Geriatric Patients. So we kind of talked about what's the difference between a senior pet and a geriatric pet. And seniors, for the most part, are just animals over a certain age, but geriatric really means that they're more frail, they're more delicate, they are more susceptible to environmental, factors such as heat and cold and wet, those types of things. And so for those more frailer pets that are nearing the end of life, but it's still not clear when that's going to come, man, there's all kinds of things that we can do in the home to make their existence and companionship better, such as carpet runners and ramps and all those kind of things. Love when people embrace that sooner than later, because often when we start to implement those things too late in life, sometimes it's too late, where we can't make the biggest difference that we wanted to. Okay. So nothing like good palliative comfort care earlier in life.
Great. So I just want to make sure I get the terminology correct. You call it comfort care. You also mentioned like a geriatric checkup. Are they basically the same thing?
Yeah. It depends on the hospital or the clinic that anybody is working with. They might call it a geriatric wellness visit or a senior wellness visit. But those actually, and I'm glad you brought that up, those really should be done a minimum of every 6 months, because you think about it, if pets age faster than we do, as the old adage of 7 years to 1 year for human, the fact is that they're aging much faster. So while they're younger and we might do a wellness visit every year, as they get older, especially, maybe age 7 for a dog and maybe age 8 or 9 or 10 for a cat, that they should start being seen every 6 months.
Okay. Wow. Thank you for all this information. This is a fountain. So thank you. Moving on to you, can you tell us a little bit about growing up or even recently, any animals in your life, any animals that have inspired you?
I actually was not anticipating becoming a veterinarian until I was already in my late 20s and really kind of find a calling for that work. And I thought I would be just a general practitioner. But it was as I was going through vet school, in fact, just about to graduate in 2004, that my husband's dog, who, became my dog when we got married, was about 15 and a half when it became clear that he had cancer. And, I just had graduated vet school. I didn't have all of my medical supplies and those things, and I really wasn't quite sure how to best support him with euthanasia at the time. And I worked with a colleague that came to our home and euthanized him underneath the aspen tree in the front yard. And it was an absolutely beautiful experience, just beautiful. Mm. And I took that experience with me into private practice for a couple of years. And where I was practicing, we were unable to leave the clinic to offer home services. And I remember thinking, I don't like that. I really, I appreciate how nice euthanasia can be in the clinic setting when done well, but I really wanted to be offering it in the home. So when I left that practice, which was the right thing for me to do at the time, I wanted to start Home to Heaven and offer those better experiences in the home setting. So that experience with that yellow lab underneath the aspen tree was very changing for me. And I also grew up with Great Danes as a child. And I remember times where my family chose euthanasia for those dogs due to different reasons. But I remember my father loading those dogs up at different times. This is sometimes 5 years down the road and not close together. But loading up those big dogs and bringing them to the emergency room or going to the vet's office. And I remember thinking how difficult it is to move such a big dog. They should have been at the home where they really wanted to be. And I thought of cats and everything. So that really shaped me to want to be a home provider. And just, I'm really, really passionate about that. In fact, I always say that when it comes to end of life, years ago, we think about James Herriot and those country mobile vets that provided all of the care in the home setting. And then there was a shift in veterinary medicine where all the vets started to be in clinics and pulled all the medicine to the clinic. Well, they should have kept end of life at home, whether or not it's hospice and in those final days or euthanasia, just keeping it in the home setting. So that was pretty instrumental for me. And then now I do love to adopt older dogs. My older sweetheart, that chocolate lab that I mentioned, she was the oldest one that I adopted, and that was a couple years ago. But we did adopt a 9-year-old Jack Russell as well. She's now 15 and a half herself and going strong. And in fact, I talk about her at 15 and a half. This Jack Russell Terrier is not geriatric, right? So geriatric and senior are very much, they're more in the mind, or we say that, versus concrete. Sure. Because there's nothing frail about her. She chases everything all over the farm, and she has a great farm life here. But then I've got a 4-year-old black lab who's lovely. I really enjoy her. In fact, I adopted her at the same time as that elderly lab, and so that was a good fit for our family. And now we have an almost 1-year-old pug puppy who is the dream of my children. They just always wanted a pug, and she came from a rescue in Kansas. We're all about rescues here, so I adopted her out of a rescue in Kansas, and she had a lot of special needs. She's already had bilateral knee surgery, and she had one hip removed because she didn't have the best breeding at that rescue, and so I figured we'd be a good fit for her. So we have 3 lovely dogs here on our farm, and I do have my senior girl, though, which I absolutely adore.
Wow. Thanks for sharing all that. How do folks find you, whether it's online or social media?
So online is a great way to find me. I do have a website, Kathleen Cooney, DVM.com. That's my consulting site. And then I also have the Home to Heaven website, which is hometoheaven.com or .net. That's a good way to find me. And both sites can email connect to me. And then for social media, I have my Facebook pages, and I also Instagram and Twitter, and they can just find me through my name, Kathleen Cooney.
Great. What's the best way to find the next great webinar taught by Dr. Kathy Cooney?
Oh, good question. Let's see. I've got one coming up with the IHPC on August 20th, and that information will be posted on the IHPC website very soon. Again, that's IAAHPC.org.
And
I did just finish up one.
Sorry to interrupt. In general, do you need to belong to those organizations, or is there some type of membership?
You do not.
Oh, okay.
No. Yeah, you can certainly be a member of the IHPC. That would be lovely. But and if you are a member, you get the webinars for free. They're one a month. And last month there was one on compassion fatigue. The month before there was a business one. So lots of different topics. So you can, I believe they're $25 each if you're not a member. But if you are a member, they are free. And so that one's coming up August 20th. And forgive me if I should know what the full topic is, but I don't want to misquote. So I have that one coming up. And then I don't think I've got another webinar scheduled for a few months. We'll eventually be coming into my busy time of year, which is the fall, where I do the IHPC conference, and I will be in Cleveland speaking at their Veterinary Medical Association in September, and a few other events. But anyway, I just keep an eye out for my consulting website, and we usually post the webinars there and other events that I'll be at.
Amazing. Thanks for all those resources. If we were to give you a magic wand and have you do something to change the state of animal rescue, what do you think that would be?
I would love to see the term hospice more appropriately applied. So I went and saw a rescue a year ago, just down in Denver, and they had all of the adoptable pets kind of listed out. And one of their categories, they had, of course, puppy and adult. And then instead of senior, that said hospice. And I thought, well, that was kind of interesting. Why not call it senior or geriatric, meaning that they're just trying to adopt out the older sweeties, but they call it hospice. And I thought, well, if they say hospice, to me, that implies that the dog, as this is a dog rescue, the dog is dying. And that would probably scare or, alarm more people than it needs to. So I would have loved to have seen, or would hope that this would be a universal thing for rescues, is to, if you're going to use the word hospice, as you alluded to before, Harold, is that it really just needs to be for the dying. And instead, if they're just older, getting up there in the years, to call them senior or geriatric, I would love to see that. That would be a good, quick, easy fix that animal rescues could do. Okay.
All right. Great answer. Thank you. Anything else that we really haven't covered that you'd like to share with the audience?
I would just say the importance of education. Education changes everything when it comes to end of life. A lot of my clients and those that I talk to out there that are just, kind of approaching the end of life with their pet, they're very afraid and they're nervous and they don't know what to expect. Many of them have never gone through death before, and they don't know what it looks like. They don't know what to expect. And we find that education changes everything. Knowledge minimizes and often eliminates fear. And we don't like fear-based decision-making. That's not really good for anybody. So knowledge is power. We love when families know about pain, what pain looks like, and what normal aging looks like. And should they want to pursue natural death, really what that experience is going to be like. And even euthanasia, if a family has never experienced euthanasia before, just to help them to understand what the process is really about. That I would love to just perpetuate and, kind of spearhead forward for everybody out there doing anything with animal rescue, with animal care in general, is just to really encourage education, and so that people aren't, floundering around unsure what is yet to come, but rather be empowered and prepared. I love that.
Why do you think you do what you do?
That's a good question. I'm a very empathetic person, and I'm a story girl as well. I love stories. And I don't get stories from the puppies and the kittens. I get stories from the oldies. And so I'm looking at my library of books here on my dresser in front of me, and all of those books, in my opinion, tell good stories. In fact, there's one book here that says Dog Years, Faithful Friends Then and Now, when it shows what they look like when they were young and now what they're like when they're older. And, they're darling when they're little, but they're very, very wise and mature and full of those stories as they're older. So every gray hair tells a story, right? So I love to be able to connect with my families to just support them in what is going to be, a very difficult time, can be a very sad time. And if I do my work well, that they get to cry in safe space, they get to share those stories in safe space, and look at me as a friend and not necessarily as, a veterinarian that's going to just, put forth treatment options, but not really listen to what's important to them. We really build a relationship, and that's why I do what I do. And yeah, I just can't imagine doing anything else at any other time. It would be difficult for me to go back to regular private practice, which is very enriching for many, many veterinarians out there, certainly thousands of them. But for me and my colleagues that focus on end of life, this is where it's at.
We just want to say thank you to Dr. Kathleen Cooney for sharing her story. You can find her at KathleenCooneyDVM.com or go to our show notes at thisispawprint.com/149. If you'd like to listen to more episodes of Paw Print, you can find us on your favorite podcast app. Search for Paw Print Animal Rescue and make sure to hit the subscribe button to get the latest episodes immediately. All the music you hear on Paw Print is produced, composed, and performed by the great Luke Gartner Brereton. You can find his music at info.vanillagroovemedia.com. We just want to say thank you to all of you for listening to Paw Print and sharing it with your friends and family. We've now been listened in over 130 countries and territories, and we could not have done it without your support. So thanks. And remember, you spread a positive message of love and peace by saving an animal. Have a great day, everyone, and see you next time on Paw Print.
Paw Print is a production of EVER Education.
You can't handle the truth.